Hi there, I'm Dr. Tony Mork, endoscopic spine specialist, and today I'd like to talk about the term minimally invasive spine surgery. I mean, what does minimally invasive really mean? Well, the term minimally invasive is not very specific, and that's kind of become a buzzword, but it doesn't really tell you very much. It leaves a lot of information out. Well, what kind of information does it leave out? Well, two things mainly: the tube diameter and the procedure being performed. So what does minimally invasive refer to? Conceptually, it's simple. Minimally invasive means the surgery is being performed through a tube. A tube is used to retract the soft tissues to access the surgery site. So instead of pulling on the soft tissues with a retractor or retractors, such as this, the tubes are referred to as dilating tubes since they dilate as they are inserted into the surgery site. And here's an example. You can see that the one on the bottom is called the obturator. So it's almost a solid rod, oftentimes with a hole in the middle for a guide wire. And then over that are slid additional tubes of an increasing diameter, therefore tubular retractors. And they're inserted one over the other until the tube is large enough to perform a procedure. Okay, so far so good. So what else is there to know? The next question to ask is, how big is the tube? If the whole idea is to use a small enough tube to perform the surgery, but not so much as to stretch out or injure the surrounding soft tissues or the collateral tissues in the area of surgery. So the tube diameter determines how much stretching or damage is going to happen to the surrounding soft tissues, mainly muscles. And here we see an example of how the tube set goes. You can see on the far left that there's a 5.3 millimeter obturator. This is a solid rod with maybe a guide wire to be put in the center. Next goes up to 9.4, 12.8, 14.8, 16.8, and really goes all the way up to 24.8, which is which is really an inch or a little bit more of an inch in diameter. Compare these tube sizes to a spinal endoscope. At the tip of the endoscope, we see a light source, camera, working channel, and irrigation channel, and typically the scope diameters are 7, 8, or 10 millimeters in diameter. So if diameter of the tube indicates how minimally invasive the surgery is, the endoscopic equipment is much more minimal. So are there any other big differences between the tubular retractors and the spine endoscope? And the answer is yes. Regular tubular retractors are open to room air. This is because we have to get other instruments or microscope into the tube in order to see the operative site. So whether you're using cautery, irrigation, any kind of bone cutting instruments, actually the camera setup, it's all got to look down this tube, which can get kind of crowded, and that's really why the tube has to be of a larger diameter. Whereas the endoscope, everything is coming through the tip, the light source, irrigation, and the working channel. So it can be really less than half the size. So the other difference is that minimal or no contact with room air with the endoscope. In other words, the endoscope is hermetically sealed when pushed through the skin, and there is really no room air contact with the operative site. You're really operating in a bubble of water with the endoscope, whereas the larger tubular retractors, you were just in communication with room air for the surgery. But the bigger question to ask, in addition to the diameter of the tube, is what procedure is being performed? This is huge. And I've seen more than a few patients coming into my office after a minimally invasive fusion. A fusion is not a minor procedure, even if it can be performed through a tubular retractor. The goal of a fusion is permanent loss of motion of a spinal segment or segments. And if you didn't like it, there's no going back. The fusion or implant is in place, and there is no going backward. Most people are trying to avoid a fusion these days, no matter how minimally invasive it is. Minimally invasive doesn't change the nature of the procedure. For example, a fusion can be performed through a tubular retractor as opposed to, say, a decompression. But the nature of it, one is a fusion, one is just a decompression, but they both can be performed through a tubular retractor. The goal of a fusion is permanent loss of motion of a spinal segment. And kind of the philosophy of this is no motion, no pain, which I don't think is correct, but that's kind of the driving philosophy behind fusions in many ways. Well, there's two takeaways from this short video. One, know what procedure you're getting, even if it's minimally invasive. Ask if you're getting a fusion. Fusions can be performed with minimally invasive equipment. Two, minimally invasive doesn't say how minimal. What's the diameter of the tube? If the diameter of the tube determines how minimally invasive the surgery is, endoscopic surgery is the least invasive by far. Thank you very much. Thanks for watching. If you have further questions, don't hesitate to go to the website or submit a question here. Thank you.